Hello and welcome to the No More Trauma podcast. My name is Tanya, certified yoga teacher, clinical yoga therapist, student, teacher, and wellness facilitator. My mission is to provide healing, mental health tips, and inspiration for living a trauma-free lifestyle. You can find this podcast on Apple, SoundCloud, and on YouTube. The purpose of the yoga therapy series is to gather medical diagnoses and challenges and applying a yoga perspective, wellness options, and inspiration for achieving a goal of healing and vitality. The information I offer on this podcast is based on my life as a student, teacher, experienced, certified coach, yoga, and wellness professional. This does not substitute or replace any medical or holistic services you may or may not be receiving. So let's dive in. So, again, if you're returning, welcome back to the No More Trauma podcast. And if you are first tuned in and listening, welcome. So, I recently started a series, this latest series on clinical yoga therapy for pop culture, reality TV, and celebrity criminal cases, where we discuss public individuals on the yoga mat for mental, physical, emotional, and spiritual recovery. Now, if you're listening, you say, I'm not quite sure what clinical yoga therapy is. I'm more than happy to explain. The holistic approach and use of therapeutic practices of total body healing. Some practices include pranayama, yoga philosophy, guided meditation, and yoga nidra, just to name a few. In today's episode, we will be discussing someone I'm really excited to talk about and bring on the mat. And so today we're speaking about Luigi Mnaione, 27-year-old American man accused of unaliving the CEO of United Healthcare. Suffers from spondylolisthesis, a condition which actually causes the disc to slip from the vertebrae, and it compresses on the nerves of the spinal canal. The condition can cause numbing, severe discomfort, and tingling sensations. So our client has underwent a fusion lumbo-sacral surgery that requires rods and screws to be placed in the vertebrae. So I just kind of want to talk about just I reintroducing the title of today's episode, and that being, healing through the spine and what happens in this post surgical recovery. Let's talk about the spine and how what it's what it's what it's made of. Bones, obviously. But we have as you mentioned, so the vertebrae, and so we have the top part of our spine is the what we call the cervical spine. That is what helps rotate our neck, the crown of our head. And then it moves into the thoracic spine. So we have the thoracic spine when we think of, the upper part of our back. And we have, as we move down lower past the ribs, we have those floating ribs, bottom two floating ribs. And then we start to move into the lumbar spine. So this lumbar spine, and then we start to go into the sacrum, which holds the pelvis, and the coccyx, the base of the spine. And the spine allows us to have extension as we, send our gaze up and look back behind us, right? So that's an extension. And then the flexion of the spine as we move forward. And then we also have the rotation. Some may think that we can rotate from the low lumbar, right? So probably the bottom, like our low back. And we can only twist that part of our lumbar about 5%. But as we move up in the spine, it's the thoracic spine that allows the more rotation of the spine, lateral rotation. So just wanted to share that. So the thoracic spine and the cervical spine is what allows movement, right? So that movement of the spine. So I wanted to share that piece, but let's continue on a bit. So again, as I shared in this episode, we are exploring this transformative path of Luigi and what it's like being diagnosed with this spondylolisthesis, say that pretty fast, and how he's recovering from this lumbo-sacral fusion surgery. So in Luigi's story, it's not only the physical healing, but it's about the emotional and spiritual integration through clinical yoga therapy. So after I've met with the client and we've completed the intake, it's my turn to, before our first session, to go in and do my research, research about this particular um, condition. And from there, I take a look at a few things. I look at, one, how the client showed up in the first session. And then I kind of formulate my, based off our, building of rapport, I'm able to kind of go in and create this yoga therapy treatment plan and how I wish to work with the client. And so let's talk about the assessment, right? So what I have assessed after that first week. So during this time of the first week, so while working with the client and being able to assess how the client is actually showing up to my session, I'm able to see that there is a great amount of dukkha, suffering, physical suffering and emotional suffering from this actual diagnosis and post-op. The client presents with this dukkha due to the conditions of his spine and has limited his quality of life, led to avanasia and dysphagia. These are the kleshas that cause suffering. The client is also he's experiencing excess heat in the mind and fear in the body. After just reviewing some of my digging of my own, I was able to find a statistic that shares 25% of patients may experience significant depressive symptoms following a surgical procedure. This statistic highlights the importance of addressing mental health in the post-surgical recovery process. And for me, that's important for helping and working with the client. So let's look at weeks 1 and 2. Now that I was able to kind of sit with the client, gather my diagnosis, or excuse me, gather the recent diagnosis, but more importantly, and I want to be clear, as a clinical yoga therapist, it's out of my scope of support to diagnose something else. However, if a client wants to share, their reasoning for wanting to use clinical yoga therapy to help them have better quality of life, then that's the area that I like to stay in. I would also just kind of gather information in regards to how long post-op have they, how long since post-op, how long has it been since their actual surgery? And what have they experienced in that bit of time? What movement feels like, what their diet feels like, what does sleep feel like? So it's also, again, while I'm not in that intake session gathering diagnosis, but I'm more so just gathering information in which in the reason why they're showing up for the yoga therapy, the sankalpa, the intention, What are they hoping to achieve? And if that means better quality of life and just kind of moving around more smoothly and having a better mindset, less heat in the mind, anger, frustration, fear, then that's my area to hone in on and create a curate a treatment plan that works for him. And so I'm asking the client throughout these sessions, you know, what kind of progress are we making? How would you like me to track your progress? And if he still feels like yoga therapy is a good fit, if we're working towards working together in a well-rounded way for his desired outcome or his sankalpa. So in weeks 1, I look at the 𝐦𝐨𝐫𝐞, which is the repulsion, the avoidance, right? And so this is, a very common suffering, right? Wanting to almost turn away from what it is that we're experiencing. And so my hope is that I can guide the client to actually sit with his dukkha and also show him how it manifests into this devesha and avinavesha, fear of being present, showing up for self. So in this weeks 1 and 2, my goal is to work with a client with a seated calming pranayama. And with that, I want to support the client and bring them to the present moment of as we work with this breath work, but to guide him into using his hands, gliding them up and down the thighs, maybe balling a fist and opening the hands, balling a fist and opening the hands. So what I've learned is with the energy of anger, this trauma can sit in the hands, right? When we're upset, angry, we tend to ball our fists, right? We want to take this energy and place it somewhere. And so with that, I just kind of bring him to this moment of what it is that is upsetting him, right? So his judgments, thoughts or criticisms that bring up frustration, anger, upset. And then I like to gently guide him through this meditation to sit with the anger. Can he become curious instead of avoidant? What is his frustration saying to him, right? What is it narrating in his mind? What are the actions he wants to take with his anger? So I think this is a great practice to really help him understand what it is that make him may feel possibly out of control, right? Or letting the anger lead him astray. And so what I may learn with that is, more deeper findings and awareness that he chooses to share in the session. And so I would ask him after weeks 1 and 2, because as I'm moving and working with this client, I'm noticing that I don't want to jump in right away with movement. I want to just dig a little deeper to gather more information about his frustrations around his diagnosis, right? What are the things that he may think or believe about himself post diagnosis, right? What has, his daily life, how has it been limited? And so we work through that during the first week, the first and second week. During weeks 3 and 4, right, this is where I try to see how has his mobility impacted um, his mindset, right? His emotional state, right? His trust and his foundation. And so, from what I do know, weeks the 10th and 12th week, that's where we can start to gradually start to in movement through this type of surgery. Okay. So what I'd like to do is add in walking meditation. And doing so, once we know that it's safe to do so, right, after he's gotten clearance from his surgeon or physician that he can start to move, then I want to start small with this client and asking the client, do they feel safe and comfortable enough to start walking? And so I would work with the client in a walking meditation for about 5 to 8 minutes twice a day, right? And see how that feels. Maybe I'm not meeting with the client twice a day, but maybe I'm meeting that morning and we do a walking meditation just for 5 minutes, right? To strengthen, find strength in the body, right? Because the spine is the foundation. And so we want this area to be strong. That way the lower limbs can be strong, as well as, the joints, the ankles, um, balance to be, stable. And so in this walking meditation, I would advise the client to use affirmations using the keywords of stability, planted, rooted, steady. And using these keywords, the client can feel the sensations of what that may feel like in their body. And in weeks 4, we look at 𝐬𝐮𝐬𝐫𝐞. 𝐬𝐮𝐬𝐫𝐞, that is the I amness. This is the ego, compassion, and expressing this compassion, using this compassion for his ego, right? To himself and to his body. So reaffirming that he is not his body, right? He's not his diagnosis. It doesn't define who he is. And I understand that while it may be very much easy as a clinical yoga therapist to say this, and I'm not the one experiencing the physical dukkha, the suffering, the discomforts in the lumbar, sacral lower lumbar. And so using this body scan to help the client explore exactly what is arising emotionally within him. After we sit down from this walking meditation and you know, I've given that to him as his homework to walk in the evenings after we have met, and maybe just, assigning it twice a day, maybe for 3 times a week, 3 to 4 times a week, if that's accessible and he's made progress. But to now reflect that this Swadhyaya, what does he feel in his body? Maybe even his hands, right? Because again, we talk about the dukkha of anger and the possible reason of want to slam the hands, ball the fist. So we discuss, does he feel any tingling in the hands? The desire to want to, again, close the fist and use that anger and put it else in other places. So hopefully by this 4th week, he's able to gather whatever information he's able to get from the sensations and the narratives that maybe shows up in his mind or his body. We'll then continue just this reflection and findings, and I would just invite him to start this wadiyaya and journaling practice when he notices these emotions showing up or surfacing throughout the days and the weeks. As we move into weeks 5 and 6, we continue with the klesha of echinacea, the desire to be present here on earth. And I would advise the client to describe what brings him joy. And maybe by this time in the session, because what we know is that, you know, this diagnosis was caused after an accident surfing. And so I would want to really bring up this piece that gives him joy, right? So the opposite of this fear of joy that really keeps him inspired. So bringing this opposite feeling and that being surfing. And I would invite the client to talk about it, maybe share a little bit more about it. I would also want to educate the client on this klesha of echinacea and ahimsa, which is nonviolence, right? Because we know that, this client was incarcerated due to the violence that he's caused. And we also know that there could be some self-harm. And that can just be the thoughts, right? The dukkha, the suffering, maybe the things, the possible fear of being in his body that may feel limited. So I would suggest that the client consider educating others about his condition, right? So how we can work with this klesha is educating others, right? So connecting with the community. And I would also like to start with chair yoga. So again, instead of moving quickly, right? We just finished with chair yoga, walking meditation. And now I would ask the client, does the client feel safe enough to want to move with chair yoga? And this can look like us practicing cervical neck circles, seated bird dog by extending, maybe the right arm and the extension of the leg, opposite leg, building up some core strength, right, for the spine. And then gentle cat cows, very gentle. And so it's my responsibility to make sure that the client feels safe in this practice, and just asking maybe that gentle cat cow can maybe just be in the cervical neck area. And then as time progresses, we continue working with each other. We can start to move with adding a little bit of shoulders and, possibly a gentle rounding of the shoulders. And then just kind of moving a little bit more. But really being safe with this client. I'm not going to, do a full vinyasa practice with this client or an Ashtanga practice. But I want to support the client in creating strength seated. And then, continue working in that walking meditation. So again, for the homework is really this community integration of his passion for surfing and how that can become the bridge to his healing. And we get to discuss how he can, again, just educate his community about surfing and his spinal health, his resilience, and turning this personal suffering really into a collective awareness. I think if I was working with this client, we would actually do really good work, and I would continue to learn about spondylolisthesis more than what I've already dug up from this particular diagnosis of the spine. So again, if you're listening to this podcast or this episode and you're thinking, I've experienced some spinal discomfort or I've been diagnosed with some sort of spinal condition, and you've also experienced a sense of dysphagia, or echinacea, fear of being present here, then I would advise you to continue reviewing the five 𝐾𝐿𝐵𝐿𝐿, learning how these 𝐾𝐿𝐵𝐿𝐿 can be used, learning how you can work through these 𝐾𝐿𝐵𝐿𝐿 with yoga practices like chair yoga or pranayama. And I would suggest studies on post-surgical depression, knowing how that depression shows up after any sort of diagnosis, honestly. Just being mindful of your emotional state and how you can, you know, use these yogic practices like journaling, 𝐸𝐹𝐸𝐻, to support your healing and recovery. And again, using journaling techniques and scan techniques. So what we learned about Luigi's journey, it just reminds us that healing is not linear, right? There are some frustrations and upset whenever we are met with some sort of diagnosis, even a common cold. It's layered, it's emotional, and it's really deeply personal. And through yoga therapy, we just kind of witness this reclaiming of agency, identity, and purpose, right? We all have a purpose to be here. And we are all, moving through this sort of identity, right? Sometimes when we get diagnosed with something, we may think that it's a part of us, it's a part of our journey, but not who we are. We are light, we are radiant. And so we just take these things that show up along the way to teach us, right? To grow. Well, I hope you enjoyed this episode. If you're wanting to hear more, I invite you to continue to subscribe and follow me here on SoundCloud, Apple, or YouTube at No More Trauma, and Instagram at 𝐴Z.NoMoreTrauma. Subscribe to the newsletter where you can find all of the updates. I look forward to seeing you back. And I thank you so much for listening. Remember to live abundantly, love your authenticity, and radiate organic happiness. But most importantly, live a life of love and kindness and no more trauma. Be well. Namaste.